Hello everyone, we got Mark back here talking today about the Hornblower's test, our best physical exam test to try and isolate the Teres Minor, one of our 4 rotator cuff tendons. Unfortunately, this test doesn't 100% isolate the Teres Minor, but to be honest, there's not really a physical exam test that does, so this is as good as we're gonna get it. Hornblower's test is pretty easy to perform in clinic. First thing we're gonna do is we're gonna abduct that arm to about 90 degrees. We're gonna make sure our elbow is flexed to 90 degrees as well, and then we are going externally rotate that shoulder so our fingertips are pointing up towards the sky. From this point, what we'll do is we'll place a hand here in the back of the patient's hand and wrist and tell them to press back against you. In just 1 second, I'll get my assistant up here and we will show you all how we rock the Hornblower's test to evaluate that Teres Minor. All right, everybody, I got cowgirl Lexi here with me today, and she's going to demonstrate how we would tell our patients to do our Hornblower's test. So what we're going to tell her to do is bring that arm up. Make sure that elbow's bent to about 90 degrees. Turn it back like this so those fingers point up towards the sky. Once we're in this position, I'm going to place a hand behind you, and I want you to press back against me as hard as you can. Perfect. Thank you, Lexi. Yeehaw. There we go. Okay, so we just saw a great example of a negative Hornblower's test. What would a positive Hornblower's test look like, and what would it be indicative of? A mildly positive Hornblower's test, or a little bit of pain, a little bit of weakness with that resisted force, may be indicative of a small injury to the Teres Minor rotator cuff tendon. Maybe something like a very small partial thickness tear or a tendinopathy, some irritation, inflammation in that tendon. If our patient has a significantly positive Hornblower's test, is having substantial pain, substantial weakness, a real hard time with this one, may be indicative of a large partial thickness tear or full thickness tear. All right, everybody, I hope we were able to give you some valuable information today on how to perform the Hornblower's test in our clinic to evaluate some Teres Minor rotator cuff pathology for our patients. Super easy test to do, but super informative for a rotator cuff evaluation. We appreciate your time today, and we hope you had as much fun as we did. Thanks, y'all.